So what is bodywork? In bodywork, we test and feel for restrictions in the body, in the organs, in the nervous system, and in the fascia, not just in the musculoskeletal in a range of motion type way. Massage may be able to help relieve pain in some instances, but it's not always the cure for chronic pain. In fact, Jean-Pierre Barral, the founder of visceral manipulation, stated that 90% of musculoskeletal pain and problems are related to organ mobility and function, which can be limited by toxins and trauma and tension. So working with the body, doing body work on the fascia and the organs and the nervous system can cause changes in pain, changes in the bones and the joints. Releasing those restrictions can increase blood flow, increase lymph flow, can help with chronic pain and help to regulate the nervous system. So we may be able to get to the core issue for why you are experiencing pain. In a bodywork session, you remain completely clothed and you go through perhaps a series of tests. I may just place hands in areas of your body to feel for restrictions, and we're really going to listen for what the body is indicating its needs are. In a craniosacral session, which is different but often incorporated into a bodywork session, in craniosacral session, there's very gentle pressure applied to the cranial bones to assess the tensions and restrictions and the fluid flow within the craniosacral system. It's very light pressure, usually no more than 5 grams, which is the weight of a nickel. Gentle pressure applied to the bones to help create space, release tension, especially off of cranial nerves and off the whole craniosacral system. Both of these sessions typically take about an hour. If it's your first appointment, it's going to take a little longer to do your intake and assessment and to include a treatment. So I hope that answers your questions about what is bodywork and craniosacral therapy.